In summary, by bringing
Asante's mission and values are stated as the key elements that define Asante. These principle guides the decision which we make about who to hire, what technology to invest in, how to design our facilities, and what kind of care we ultimately provide. Upon merging, the values will remain as excellence in everything we do, respect for all, honesty in all of our relationships, service to the community, physicians, and each other, and teamwork always. Those are strong values, two of which are also Providence's values, so the system will be familiar and able to learn the others easily. This is a strong foundation and will set up our merge for success. By applying our values, the system will maintain excellent employees who enjoy their job, which will increase the employee retention rate. Once a quarter, our new system will display one of the values in the cafeteria and engage our staff by raffling off items to staff that participate in educational activities around the value. This initiative will increase our system scorecard that we show accrediting companies, which is how they rank our system to other like systems. Along with our value, we will be focusing on emotional intelligence immediately upon merging. Emotional intelligence ties into our pillars through honesty, excellence, and teamwork. With emotional intelligence, you can be assured that our employees will help facilitate a smoother transition during the merger. My recommendation is to create a pilot group that will take a course on emotional intelligence. Start it off by having this group take a Myers-Briggs personalities test and provide an introduction on emotional intelligence and how it's applied in the workplace. Next, we will coordinate weekly meetings for this group to come together and discuss their weekly findings and how they were able to apply it with difficult situations that they encountered for the week. This is also when they will review real applications, whether that be a coaching that occurred or a team building meeting that took place. This is also when the team will bring forward challenges that are happening in their department that have not been resolved. This team will work through those problems and come up with solutions that could have been better based on the dimensions of emotional intelligence. This team will also be the focus group that teaches frontline staff. I would request a budget of $3,000 be set aside to get the pilot group trained. The benefit will surpass the initial expense. Having high levels of emotional intelligence in the workplace through the system will increase productivity, and that means your staff will be working harder and more efficiently.
Since we have a high focus at Asante on providing better health care, we will be bringing Providence into the Asante healthcare system. In order to do this, we need to focus on the teamwork between the two hospitals. To create an atmosphere where teamwork and collaboration are a norm, I recommend that we use the behavior modeling method as we bring Providence's policies and procedures in line with Asante's. We should start with the managers at Providence and pair them up with the managers of the same or similar departments at Asante. Once we have the managers paired up, the managers at Providence will shadow the managers at Asante. When that is complete, we will reverse the process and have the managers of Asante shadow the managers at Providence as they start to implement the new systems and new procedures that Asante has established. As we go through this process, it's important that we have a daily and weekly feedback from these managers so that we can provide real time adjustments and coaching opportunities. Having The managers between the two hospitals work closely together will not only give them the ability to learn in a real world situation, it will also establish a basis of sharing best practices between the two hospitals. Once all of the managers have gone through this shadowing process, they will then return back to their employees and give them the feedback from their experience. Once all of the managers have done that and we start implementing the new procedures, then all employees will have a counterpart from Providence at Asante that they will shadow so that we can create an atmosphere of teamwork where they're getting to know each other. And also, it will allow them, Providence employees, to see how the Asante system works. This will create a atmosphere of collaboration and teamwork between the two hospitals so that we will create a feeling of one hospital and not two separate hospitals. As we bring the two hospitals together, we should be able to cut down on administrative costs by 20%. This cost savings will come through the consolidation of departments between the two hospitals that are not necessary for each hospital. For example, we will consolidate the billing departments into one central billing department that will allow the space used for one of the billing departments to be used for other purposes to better benefit the community, whether it is more beds or a new program. There are many options that we can have to use this space and to also use the employees that are no longer needed in that department. We can relocate them into areas that are lacking and need more help. In summary, by bringing Providence and Asante's healthcare systems together, we will be able to provide a better healthcare system for the community. Patients will no longer be delayed when they need to transfer between hospitals for some medical reason or a medical procedure that needs to be done at the other hospital. Currently, there is a lot of red tape that is associated with transferring patients between hospitals, such as making sure that the insurance will transfer. There's a lot of paperwork that needs to go between the two hospitals and so on. Once a patient will be admitted into the system under this combined healthcare system, they will be transferred between the hospitals in a much smoother process, in a timely manner that can provide better health care along with saving lives. And also, it will cut down on the administrative aspect of going back and forth and making sure that all the bases are covered in transferring the patients. We will just transfer them within our own system. By also focusing on consolidating departments within the organization, we will be saving money by cutting back on duplicated programs and departments. This will be a key factor in saving money that can be allocated in other areas of the hospital. As we go through this, a key part of bringing these two hospitals together will be a high focus on the values established by Asante. Since Providence already has several values that are similar. It should be an easy assimilation between the two merging hospitals. We will also be focusing on the employee training with emotional intelligence and focusing on teamwork and collaboration between the two hospitals. This will be a key factor in providing the best health care possible. Thank you.